Top 10 warning signs of silent heart attack. When you think of a heart attack, you probably imagine someone holding their chest and suddenly collapsing to the ground. However, a silent heart attack is one that has no symptoms, mild symptoms, or symptoms people don't connect to a heart attack. But it's still a heart attack, myocardial infarctions, which means your heart isn't getting enough blood flow and oxygen. This injures your heart, but if you don't know you are having a heart attack, you may not get the medical help you need to limit the damage. This is why it's important to make time to pay attention to how you are feeling. So in today's video, we will share with you the top 10 warning signs of silent heart attack and you should not ignore at all. Number 1. Chest pain. Chest pain during silent heart attack can be mild or even absent. You might feel discomfort, pressure, or a squeezing sensation in your chest. The pressure usually feels like an uncomfortable squeezing sensation in the center of your chest. This pain is also known as anginal chest pain. It can feel more like a cramp than anything else and lasts for several minutes at a time. If you experience this kind of discomfort in your chest, it's high time you visit your physician for early treatment. Remember, the sooner you take action, the better you reduce the risk of permanent damage to your heart. Number 2. Shortness of breath and dizziness. During a silent attack, you may experience unexplained shortness of breath or feelings of breathlessness, often accompanied by dizziness. These symptoms can be mistaken for fatigue or respiratory issues. When inhaling and exhaling, the lungs may feel heavy or the patient may feel compelled to breathe rapidly and shallowly. It may result from anxiety, anemia, or allergic reaction, but the underlying cause is usually lung or heart trouble and is more common in women. Always remember, shortness of breath is not a symptom to take lightly. Number 3. Lightheadedness. Lightheadedness, a sensation of near fainting, can occur due to reduced blood flow to the brain. It might be experienced as a vague feeling of being unsteady or a brain of passing out. This also happens when a particular part of the heart is blocked, which enables the heart to supply enough blood needed in the body. Hence, it leads to dizziness. So when you see this, kindly visit your doctor to determine the cause before it's too late. Number 4. Cold sweat. Sweating when one feels hot or during exercise is a natural process whereby some amount of sweating is expected. However, unexplained cold sweat, especially if they occur without any physical exertion or anxiety, can be indicative of silent heart attack because it happens when your arteries are clogged. It takes more effort for the heart to pump blood, so your body sweats more to keep the body temperature down during this extra exertion. So if you are sweating more than usual, it is accompanied with other warning signs like nausea, dizziness, and lightheadedness. Immediately visit your doctor for examination. Number 5. Nausea, poor appetite. Nausea or vomiting without any apparent digestive cause can be a subtle sign of a silent heart attack. Some feel full even if they have not eaten a lot. This could be due to the fluid retention and the heart is not pumping efficiently. The volume of the circulating blood decreases and gets diverted from the digestive system to more vital organs like the brain. This leads to loss of weight and muscle loss due to lack of appetite. It might be also mistaken for stomach issues or a viral infection. Number 6. Weakness and fatigue. A feeling of overwhelming weakness or fatigue beyond normal tiredness could be an indication of a silent heart attack. This occurs because during heart attack there is extra stress on your heart to try to pump blood, while the blood flow is blocked, making you feel tired. However, fatigue could be changed in sleeping routine or workload carried out during the day. So when you see this kind of signs, it is better you visit your doctor for early treatment. Number 7. Persistent flu. Heart disease is a known risk factor for developing serious flu complications. Amongst others hospitalized with flu during recent flu seasons, heart disease was one of the most common chronic long-term conditions. About half of adults hospitalized with flu have heart disease. A growing body of research suggests that influenza virus infection itself could put people at increased risk for acute cardiovascular events like heart attack and stroke. Also, the study carried out in 2018 found that people were 6 times more likely to have a heart attack in the week after being diagnosed with flu. Even though influenza itself may not lead to heart attack, but it may show that there is some underlying issues in your body. Number 8. Jaw, neck or upper back pain. Research has shown that many people who experience heart attack, they tend to have experienced jaw, neck or upper back pain. This happens because the heart cardiac muscles contract with great force to pump blood to the parts of the body. Therefore, this can lead to stress to your bones and ligaments, leading to aches and in your jaw and neck. Number 9. Swollen legs and ankles. Swelling occurs when there is fluid buildup in the body. So during a heart attack, the heart loses its power to pump blood more effectively throughout the body. As a result, blood eventually remains in your legs, ankles and feet, which can lead to edema. Also, the blood supply to the kidney gets disturbed, making them less able to get rid of sodium and water out of the body. So fluid retention is a sign of heart attack in about 20% of cases. When you see such kind of signs, it is important to visit your doctor or a professional medic for checkup. Number 10. Trouble sleeping. Following a heart attack, you can feel anxious and emotional. This can affect the quality of sleep you have each night. Sleep is important to regulate mood and memory and learning functions. Also, sleep assists the body by regulating hormones and contributing to a healthy immune system. So in case of a heart attack, the left coronary artery is blocked because of accumulation of fat or blood clot. This prevents sufficient blood supply to some parts of the heart. When hormones discover this, it leads to difficulty sleeping during nighttime. Now, when one day it happens you experience any signs or symptoms and you are not sure of it, anything to worry about, it's best to consult a physician and not to take risks. If you think you have experienced the symptoms of a heart attack, kindly visit the hospital for immediate checkup. With that all, if you find this content informative, let's know at the comment section below. Don't forget to click the subscribe button and like.